So you're watching this, and there's a good chance it's because a number on a lab report has you a little on edge. You saw the letters PSA and a result that was, well, higher than you wanted to see. And I totally get it. Your mind can jump straight to the worst case scenario. But just for a second, before you go any further down that rabbit hole, take a deep breath. The whole point of this explainer is to help turn that anxiety into actual understanding. Okay? Let's dive in. This right here, this is the most important idea to get in your head from the get-go. A PSA result isn't a verdict. It is not a diagnosis. Think of it as a signal light on your car's dashboard. It's telling you something needs a closer look. So the key is learning how to read that signal correctly, and that's exactly what we're about to do together. You know, one of the biggest misconceptions out there is that the PSA test is strictly a cancer test. A much better way to think about it is as a prostate activity marker. It's just telling us that something is happening with the prostate gland, but it doesn't tell us what that something is.
Okay, so what even is PSA? It stands for Prostate-Specific Antigen. It's just a protein that the prostate makes, and, having a little of it in your blood is totally normal. But when the prostate is busy for some reason, maybe it's irritated or enlarged or inflamed, or, yes, potentially affected by cancer, more of this protein can leak out into your bloodstream. The key word in all of that is or. Cancer is just one of several possibilities on the list.
Let's make this really concrete. Imagine a man, let's say he's in his early 60s, goes in for a routine blood test. His PSA comes back at 6.4. Now, he's probably heard somewhere that anything over 4.0 is a red flag, so his immediate question is, do I have cancer? And the honest-to-goodness answer, based on that one number alone, we just don't know yet. It's kind of amazing how many different things can nudge that PSA number up. For instance, BPH, that's just a fancy term for the prostate naturally getting bigger as men age. A bigger prostate simply makes more PSA. Makes sense, right? Or prostatitis. That's just an inflammation, which can cause a really big spike. Even simple stuff like recent ejaculation, going for a long bike ride, or having a urinary tract infection can mess with the result. And this is exactly why a single number is just one little piece of a much bigger puzzle. A good urologist is immediately going to look for context. Sometimes the very next step is just to repeat the test in a few weeks, after making sure, none of those other factors are at play. You would be surprised how often that number just settles right back down on its own. So what's often way more important than a single snapshot is the trend over time, what doctors call the PSA velocity. I mean, look at this timeline here. Seeing a single reading of 6.4 is one thing, but seeing how it climbed steadily from 2.5 over 4 years, now that tells a much more significant story. This kind of pattern is what really gets a specialist attention. So you've got these two different pictures, right? On one side, you have that gradual, consistent climb. That suggests something is persistently going on with the prostate, and yeah, that probably warrants a closer look. But on the other hand, if your PSA kind of bounces around a bit, say from 3.5 one year to 3.2 the next, then up to 3.8, that's often just normal biological static. It's far less concerning to a doctor. Okay, but what about the numbers that cause real alarm? I'm talking a PSA of 30, 50, or even higher. It is completely natural to assume the absolute worst. And look, while it's true that the probability of something serious goes up with a number, even these really high values do not automatically mean cancer. So what else could possibly be going on? Well, a really severe infection, something called acute bacterial prostatitis, can cause a massive PSA spike. But it usually comes with other pretty obvious symptoms, like a fever and pain, or not being able to empty your bladder. That can really irritate the prostate and send the PSA soaring. The point is, again, context is everything. So when a PSA level stays up there and we've ruled out all these other causes, that's when we shift gears from just screening to actually diagnosing. But remember the goal here. The goal is clarity. It's about getting a clear picture of what's going on, not about creating panic. And the process today is so much more sophisticated than it used to be. So here's what that modern path usually looks like. After confirming a worrying trend, the next step is very often a specialized prostate MRI. And this is a huge development. The MRI can actually spot suspicious areas. Sometimes a clear MRI might mean we can just keep monitoring. And if a biopsy is needed, we can now use that MRI like a GPS to guide the needle precisely to the area of concern, which makes it way more accurate. Now, this next point is incredibly important, so listen closely. Even if a biopsy does confirm that there's cancer, it might come as a real surprise that the recommended next step isn't always some aggressive treatment. And why is that? Because we've learned that many prostate cancers are very slow growing. This brings us to a strategy called active surveillance, and for the right patient, it's a total game changer. It means we actively monitor the cancer with regular tests and imaging, but we hold off on treatments like surgery or radiation. This allows so many men to avoid or delay treatment side effects, all while keeping the cancer safely in check and, most importantly, preserving their quality of life. So you can see that a PSA number isn't the end of the story, not by a long shot. It's really the beginning of a conversation. And to have a good, productive conversation, you need to be an active participant. It's time to arm yourself with thoughtful questions for your doctor. These are the kind of questions that move you from being just a passive patient to a true partner in your own healthcare. Ask your doctor, what does my specific trend mean? Discuss the risks and benefits of the next step, whether that's another test or just waiting and watching. And always ask how any potential treatment could impact your quality of life down the road. So here's the bottom line. The one thing I really want you to take away from all this. You are not defined by a number on a lab report. That number is just an invitation. It's an invitation to have an informed, intelligent conversation with your doctor about your health. The fear you're feeling, it comes from the unknown. But with the right questions and the right information, you can move toward clarity and confidence. You're ready to start talking?